Belly buttons are a big topic for patients coming in wanting a tummy tuck. And the reason why is the result of the tummy tuck can be significantly impacted by how the belly button is inset. In a tummy tuck, we make an incision around the belly button, the old belly button, so to speak, and we remove all the skin and the fat below the belly button, sometimes a little bit from above it, and we pull everything down nice and tight. Well, after that, we then have to make a new aperture for the belly button to come through the abdominal wall, skin and fat. How you do that can greatly impact the look of the abdomen as well as how artificial, so to speak, the result is. There are many different techniques for how to do someone's belly button, how to bring it through, and what kind of scar there is. And generally speaking, where there's a bunch of different techniques for the same thing, that means no one technique is amazing. But there are some important things to consider without giving away too many secrets. Some of the things that lead to some of the best belly buttons is, number one, not making the aperture too big. All right. One of the hardest things to correct when I see someone else's, work is patients coming in complaining that their belly button is huge. Trying to correct a really big belly button can be quite challenging. Number two, having a belly button that is, an odd shape. And sometimes it can be too long, sometimes it can be too wide, it can be excessively oval. Can be a challenge to correct. And then most importantly, I think that what you do underneath to the umbilical stalk is super important. If you don't address the umbilical stalk, then the belly button tends to sit flush on the abdominal wall, and it almost just kind of looks like a coin sitting on the abdominal wall, as opposed to having that nice little innie appearance that kind of pulls things down and kind of gives the abdomen a contour. A lot of the contour of the abdomen after that tummy tuck is related to what is going on with the forces pulling on the inside of that umbilical stalk. And so really doing some things underneath the hood to, shorten that umbilical stalk and pull things down appropriately really kind of impacts the look of the belly button. Okay, this is Dr. Bond. Thanks for listening. Like, comment, subscribe, and follow along for more content.